Athlete's foot, also known as Tinea Pedis, is a fungal infection that affects the skin on the feet. It is caused by a group of fungi called dermatophytes, which thrive in warm, moist environments. Symptoms of athlete's foot include itching, burning, and stinging between the toes and on the soles of the feet. There may also be redness, scaling, and cracking of the skin. In severe cases, the infection can spread to the nails, causing discoloration and thickening. Athlete's foot is most commonly caused by poor hygiene and wearing tight, non-breathable shoes. This creates a warm, moist environment that is perfect for the growth of fungi. Other risk factors include sweating excessively, having a compromised immune system, and having a history of skin conditions such as eczema. Diagnosis of athlete's foot is typically made based on the appearance of the infected skin and the patient's symptoms. A sample of the affected skin may be taken for a fungal culture to confirm the diagnosis. Treatment for athlete's foot typically involves the use of antifungal creams, lotions, or sprays. These products can be purchased over the counter or prescribed by a doctor. In more severe cases, oral antifungal medications may be needed. It is important to continue treatment for several weeks after the symptoms have resolved to ensure that the infection is completely cleared. Prevention of athlete's foot can be achieved by practicing good hygiene, such as washing the feet regularly and drying them thoroughly. It's also important to wear shoes that allow your feet to breathe, such as sandals or open-toe shoes, and to change your socks often if you sweat heavily. Avoiding walking barefoot in communal areas such as locker rooms and public showers is also helpful. It is also important to keep your toenails trimmed and clean to reduce the risk of infection. In summary, athlete's foot is a fungal infection that affects the skin on the feet. Symptoms include itching, burning, and stinging between the toes and on the soles of the feet. The infection is caused by a group of fungi called dermatophytes, which thrive in warm, moist environments. It is common among people who have poor hygiene, wear tight, non-breathable shoes, sweating excessively, having a compromised immune system, and having a history of skin conditions such as eczema. The diagnosis is typically made based on the appearance of the infected skin and the patient's symptoms. Treatment options include antifungal creams, lotions, or sprays, and in more severe cases, oral antifungal medications. Prevention includes practicing good hygiene, wearing shoes that allow your feet to breathe, avoid walking barefoot in communal areas, and keeping toenails trimmed and clean. In conclusion, athlete's foot is a common fungal infection that affects the feet. By understanding the symptoms, causes, diagnosis, treatment options, and preventive measures, individuals can take steps to manage and prevent the infection. It is important to practice good hygiene, wear breathable shoes, and avoid walking barefoot in communal areas to reduce the risk of infection. If you suspect you have athlete's foot, it is best to seek medical advice and get a proper diagnosis.